Hello everyone, I'm Dr. Wai and welcome to Bright Star Baby and Child Clinic. In this video, I would like to address the issue of autism, which is gaining recognition, especially because the modalities of diagnosing this condition are better now, and also parents are much more aware and accepting of this condition. So in this video, I would like to talk about what are the early signs of autism. Here are some clues that may help you try to figure out if your child has autism when he or she is still young. Now, I would like to just say that there are some developmental differences in autistic children when they are still babies. Particularly, there might be delays in social and language skills. However, they do crawl, sit, and walk normally as compared to other children. There may also be differences in the way that the baby interacts with other children or with their parents. It is important to note that autistic children do not appear any different physically compared to other children. There is usually no physical distinguishing features. Another thing to note is that children with autism develop at different rates in different areas. One child with autism spectrum disorder will not have exactly the same symptoms as another child with autism spectrum disorder. The number and the severity of the symptoms may vary a lot. The learning, thinking, and problem-solving abilities of people with autism can range from the gifted to the severely challenged. Some people with autism may need very little help from others, whereas some people may need a lot more help in their daily lives. Now, I will list down the features of children with autism, some examples of differences in how children with autism act, but they are by no means comprehensive. And also for the parents who are tuning in, if you notice that your child has some of the features listed below, it does not always mean that he or she has autism. The best way to know is to consult your pediatrician or a developmental specialist. Below are some examples of social, communication, and behavioral differences in children with autism. First, we'll start off with the social differences in children with autism. They tend to have very little or no eye contact with others. They may not respond to their parents' smile or other facial expressions. They tend to not look at objects or things that their parents are pointing at or looking at. They tend to not point or show objects or things to get their parents' attention or get their parents to look at them. They don't bring favorite objects to show to their parents. They don't often have facial expressions. They sometimes have trouble perceiving other people's facial expressions. They sometimes have trouble understanding what other people are feeling or thinking by looking at their facial expressions. They tend to not show concern or empathy towards others. They might have difficulty making friends or seem uninterested in making friends. They don't understand the idea of personal space or boundaries. They may avoid or resist physical contact. Below are some of the communication differences in children with autism. They tend not to point at things to show their needs or share things with others. They cannot say single words by the age of 16 months. They tend to repeat exactly what someone else is saying without understanding the meaning behind those words. We call this parroting or echolalia. They may not respond to their name being called, but they tend to respond to other sounds. For example, the car honking or animals making sounds or some loud noises, but they tend not to respond to their name being called. They may give unrelated answers to questions. They often seem not to want to communicate. They are unable to start or continue a conversation. They don't seem to understand jokes or when someone is being sarcastic, or even teasing. They are unable to do pretend play. For example, they are unable to use toys to represent people in real life. They may have very good rote memory, especially for numbers, letters, songs, TV advertisement songs, or a specific topic. So they are very good at memorizing things. They may lose their language or communication milestones, usually between the ages of 15 to 24 months. This is called regression. Here are some behavioral differences in children with autism. It includes some of the repetitive and obsessive behaviors. They tend to rock, spin, sway, twirl their fingers, walk on toes for a long time, or flap their hands. These are what we call stereotypic behaviors. They like routines, order, and rituals. They have difficulty with change or transitioning to another activity. They tend to have an obsession with certain activities and doing them repeatedly during the day. They tend to play with parts of the toy rather than the toy itself. For example, they may like to play with the wheels of the trucks and constantly just spinning the wheels on the truck rather than playing with the whole truck and simulating a race or playing with other children using the toy. They often seem to feel no pain. They may be very sensitive or not sensitive at all to certain smells, sounds, lights, textures, and touch. They may have unusual use of their gaze or vision. They tend to look at objects from certain unusual angles. They can be very organized. I will also just list down other symptoms that may be associated with children with autism. These include hyperactivity, or being very active, impulsivity, which is to act without thinking, a short attention span, aggression, self-injury behaviors, temper tantrums, unusual eating or sleeping habits, unusual mood or emotional reactions, lack of fear or more fear than expected, and also unusual reactions to the way things sound, smell, taste, look, or feel. Here are some examples of how a parent can distinguish a child with autism from other typically developing children. At 6 months old, a child with autism may have very few smiles or any expression of joyful warmth and engaging expressions with their parents. They may also have limited or no eye contact with their caregivers or parents. At 9 months old, there may be very little or no sort of reciprocal or back and forth sharing of sounds, smiles, or other facial expressions. In some cultures, people might think that the baby appears very cold or cool. At 12 months old, a child with typical behavior, with typical development, will turn his or her head when he or she hears their name. But a child with autism spectrum disorder, ASD, might not turn to look even after his name is repeated several times. However, they will respond to other sounds. And also, at 12 months old, they may not have any signs of even babbling. At 18 months old, a child without ASD but with a speech delay may compensate his or her speech delay using gestures or pointing, or just using facial expressions to convey their needs and wishes. Although he or she is lacking in the speech, they will try to compensate. But a child with ASD might make no attempt to compensate for this delayed speech, and they may just limit their speech to echoing what is heard on TV or what someone just said. At 24 months, a child with normal development tend to bring objects that they like or a picture that he or she likes and show it to their parents. And also, they tend to derive pleasure from sharing things that they enjoy with their parents. A child with ASD tend not to get any pleasure or show any facial expressions when they bring things of interest to their parents, and they may not even bring things to their parents. And also at this age, which is 2 years old, children with ASD have no meaningful two-word phrases. Bear in mind, everyone is different, including children with autism. So sure, they may have delays in social skills, language skills, communication skills, and learning skills. However, they can move and walk around and use their motor skills pretty much the same as other children. Now, one thing is they might be very good at putting together puzzles and solving complicated computer problems, but they might have some troubles with social activities like talking or making friends. Children with ASD also tend to learn a harder skill first, then only the easy one. For example, they may pronounce a very long, difficult word first, but they are unable to tell you what sounds certain letters produce. Now, after watching this video, if you find that some of the features or most of the features that were mentioned apply to your child, then don't wait. See your doctor, see your pediatrician right away. Acting early can make a difference in your child's development. Nowadays, there are many behavioral modification centers that can really help your child manage autism. The earlier you start therapy, the better the outcome is. Well, I hope you enjoyed the video and get some tips on recognizing autism. Stay tuned for my next video. I hope you have a good day. Meanwhile, stay safe and take care.